Hello and welcome to the YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, I'm going to talk to you about the basics, or else you can say everything that you should know about range of motion exercises. This is Wellness Wednesday, and on this Wellness Wednesday series, what I'm trying to do is I'm trying to educate you and inform you about some basic principles of exercises. These principles are the building blocks of any kind of exercise that you do. If you know this basics, what happens is you never go wrong in choosing the right exercise format for you. So this video is about helping you understand what are range of motion exercise and what are range of motion exercises, what are its benefits, when it has to be done, when it should not be done, and what are different types of range of motion exercises. This will enable you to identify when and how you should do exercises in different scenarios. So make sure to watch this video till the end. So let's begin. So basically, when a joint tries to move in its complete range or its full possible motion, then it is called as range of motion. In range of motion movement, or else say complete movement of a joint, every structure that is involved in that particular motion will get exercised or will get moved. And complete range of motion incorporates the movement not only of the joint but also of the tendons that are surrounding the joint, the movement of the synovial fluid, or else the synovial area, that capsule that surrounds the joint, muscles that surround the joint, fascia, as well as the nerves that surround the joint, and also the circulation, which means the arteries and veins which are present. Everything gets moved when a person is doing a range of motion movement. Range of motion basically allows us to do our day-to-day task normally. Everything that we do, or else every activity, every movement that we do needs a certain level of range of motion. For example, if I've got stiff neck, I won't be able to do nodding movements. I won't be able to watch TV. I won't be able to check my phone. I won't be able to sit in front of my laptop, because all of these activities require a certain level of range of motion on the neck region. Now, due to many pathologies, many conditions, we kind of have limited range of motion, which needs to be broken down with the help of exercise. And range of motion exercise helps in doing that. Apart from the fitness perspective, range of motion exercises are more helpful from a therapeutic perspective, which means if anybody who have pain or a stiffness in the joint, exercise program is always started with range of motion exercises, because range of motion exercises are pain-free, are gentle, and do not harm or else injure or else increase the level of injury on the structures which are already injured. Hence, if you are having any kind of joint related issues, if you are having any history of injury or some sort of systemic joint diseases that leads to pain, for the first exercise that a physiotherapist will prescribe you would be definitely range of motion exercise. Range of motion exercise can also be added in the fitness regimes, but mostly range of motion exercises are added in the fitness regime for people who are having some history of pain or some history of injury or some existing pathological condition of joint, muscles or bones. The reason being, the main function of a range of motion exercise is to maintain movement or else mobility in the joint, as well as mobility in the soft tissues or else structures that surround the joint. This is the first step of starting an exercise program for anyone who has got some sort of pathology in their muscle, joint or bones, as range of motion exercises minimizes the risk of pain, minimize the risk of increasing in the level of injury, and also minimizes the risk of increasing in the level of symptoms or as any kind of blood flow or else any kind of contracture formation. And even many research have proven that range of motion exercises actually helps or else improve the healing process of the injured structures. Hence, that's why it is a very promising exercise modality for anyone who has got some pathological history related to their musculoskeletal system. Now, when range of motion exercises are indicated, or else when a person should go for range of motion exercises. But before that, I would like to tell you what are the different types of range of motion exercises. Yes, range of motion exercises are also categorized into different types. The first type of range of motion exercise is called as passive range of motion exercise. In passive range of motion exercise, the person who is doing exercise is not supposed to do any movement, but an external force or an external person is applying its force to do the movement. Passive range of motion exercise are mostly done for people who are bedridden or else who are having some sort of severe injury where they themselves are not able to move the joint or else the body. At that time, in order to maintain mobility of the body, in order to improve the blood circulation in the body, in order to maintain the muscle girth, passive range of motion exercises are started. And that's why a physiotherapist or else the caregiver comes into the picture and they have to do the exercises which are called as passive range of motion exercises. Passive range of motion exercise, as I said, are mostly given to bedridden patient or someone who has undergone some surgery or someone who has got some severe weakness where they are not able to do those exercises. That's why this format of exercise are very highly used in IPD setup, which means where the patients are either hospitalized or else are at home and are completely bedridden or else are dependent on others for their own movements. After passive range of motion exercise, the second format of range of motion exercise is active assisted range of motion exercise. Active assisted range of motion exercise are basically the progression of passive range of motion exercise, which means when a person who was having weakness, he or she was unable to do the movement by himself or herself, now from that stage the patient has improved or else the person has improved and now there is an improvement in the strength level. But again, the muscles have not gained complete control or else the muscles are not strong enough to withhold the stress, and that's why they need some level of assistance. And that's why 50% of effort in doing the exercise is applied by the person and 50% of effort is applied by the therapist or else the caregiver who is making the person do exercise. So that's the second progression. And the third form of exercise is active range of motion exercise. Active range of motion exercise are nothing but an exercise which a person does on himself without taking help of any external thing. So these are the types of range of motion exercises. Now, different types of range of motion exercise has to be done in different stages or else different situations. These situations are, for example, bedridden. When a person has got some sort of surgery or fracture or fall or some sort of illness due to which the patient is completely bedridden or else is so weak that he or she himself cannot move, at that time passive range of motion exercise is used. As the patient gradually improves or else is able to do the movement on its own, but the movement is incomplete, at that time active assisted range of motion exercises are used. And once the patient is well, at that time active exercises are started. Progression of active exercises are further to stretching exercises as well as strengthening exercises. Active assisted exercises as well as active exercises are also the part of exercises when it comes to aerobic conditioning or else who have recovered from immobilization for a long period of time. For example, if someone has got fracture and has now recovered from fracture, first they would be put on range of motion exercises, active range of motion exercises basically for initial days so that all the joints, muscles gets freed up and then the muscles and the joints are ready for further strong exercises. So these are the times or situation when one person needs to do range of motion exercise. Now, what are the benefits of doing these exercises? Now, the first benefit of doing range of motion exercise is to maintain mobility in the joint. The first thing that happens post-injury to anyone is stiffness. The body starts getting tight and starts reducing the flexibility post-injury. And in order to make sure that the movements or else the flexibility of the body is maintained, range of motion exercises are best for that. Range of motion exercises also minimizes the chances of muscle contracture that develops post-injury or else post-immobilization. Range of motion exercises maintains elasticity of the muscles. It assists in vascular supply, which means it helps in maintaining good blood circulation in the areas which are immobilized, which is a very important thing, and also prevents the chances of thrombosis to being developed. Thrombosis is a major complication that people who have got immobilization for a long period of time have. Due to immobilization, what happens is there are small debris of fat as well as cholesterol that forms and clot, and which is running in the circular system. But due to lack of circulation, sometimes these clots gets stuck in certain area, and this leads to some major complication and even some life-threatening issues, which can be prevented just with the help of range of motion exercises. Pain reduction is another benefit of range of motion exercises. If you have got any kind of pain like shoulder pain, neck pain, back pain, etc., and if the pain is too much, all you can do is just do gentle pain-free range of motion exercises. What it will do is it will actually gradually start reducing the level of your pain, mostly when the pain is mechanical pain. Range of motion exercise also assists in healing of the sutures as well as inflammatory areas. It helps in maintaining the awareness about the joint movement, which is mostly lacking in elderly people or as people who have got some neurological deficit or else some sort of sensory deficit, and maintains the body coordination. So these are some benefits that makes range of motion exercises super simple. Definitely range of motion exercises are especially for someone who have got history of pathology. That's why they are not very popularly considered in fitness regimes, but they are a very important or is very core aspect of wellness, especially for people who have got some sort of pathology. Now, what are the limitations of range of motion exercise? Yes, there are so many benefits of range of motion exercise, but range of motion exercise will not do certain things for you. For example, range of motion exercise will never improve the strength of your muscles. For that, you need to make sure that you do strengthening exercises. They won't prevent any kind of muscle tightness that develops. Yes, it will prevent contracture to happen. That means your muscles will not become stiff, or your joint will not become stiff, but the kind of flexibility the muscles have, in order to maintain that, you need to do flexibility exercises or stretching exercises. Range of motion exercise is just not going to help you in that, and it do not improve your endurance as well. So range of motion exercises are also not designed to improve your stamina, and even range of motion exercise do not reduce your weight. So if you are someone who is having history of some sort of muscle pain or some sort of pathology that's related to muscles, joint or bone, at that time, before starting any kind of exercise program, you should start with range of motion exercises initially in order to maintain good mobility in your joints. But you need progression in order to achieve the results that you want for yourself. Definitely, these were some benefits as well as some limitations of range of motion exercise. But there are also some contraindications or some things or precautions that you should take while doing range of motion exercise. What are these precautions? Let's have a look. So the first precaution is pain. If you feel that a range of motion exercise is causing pain, then you should not do the exercise. This is the sign that some major injury is existing which needs to be addressed before doing the exercise. The second precaution that you should do while doing range of motion exercise is that there shouldn't be increase in bleeding. So mostly range of motion exercise, as I said, is given to a person who has got some sort of pathology, some sort of injury. If your injury incorporates some sort of cut marks or some sort of bruises or suture, and if doing this exercise starts leading to bleeding to those areas, then you have to stop the exercise. You need to address why that bleeding is happening. You need to stop that bleeding, and then only you can start the range of motion exercises. If you have got any kind of pus oozing out of your wound, at that time also you should stop doing your range of motion exercise. It needs more medical attention, then only you can start off with the exercise. If you have got some history of heart issues, or else you have been hospitalized, or else if you have got some heart related condition or some heart related surgery, before starting exercise you have to be very cautious, and you should take advice of your physiotherapist and then only start these exercises. Again, range of motion exercises are not synonymous to stretching exercises. Stretchings are completely different. Strengthening exercises are completely different. So don't think that range of motion exercises are going to increase your strength or else is going to help you reduce your weight. These are mostly used in therapeutic scenario, and sometimes for someone who has undergone from some sort of pathology, for them it would be a start or else the initial phase of fitness regime. It's the decision which is completely clinical and needs to be done with the help of and collaborated effort from a physiotherapist as well as patient. So if you want to start off range of motion exercises, make sure to speak to a physiotherapist or else your healthcare professional before starting them. I hope you found this video informative. This exercise information is definitely going to help you out in getting clarity about exercises in general. I hope you found this information helpful. If yes, make sure to like, share and subscribe to HealthQ channel. I'll see you in another video. Thank you.